Studio this morning from McDonough District Hospital and the Monmouth Clinic. We have President and CEO Bill Murdock. Good morning, Bill.
Good morning, Vanessa.
Also with us is Vice President of Business Strategy, Patrick Osterman. Good morning, Pat.
Hey, good morning, Vanessa.
Good to see you both. How are you?
Good. We're doing good. Yeah, we're glad to be back with you today.
Yeah, it's excellent to get caught up with you, and a lot going on in May. Tell us all about it.
Yes, we have Nurses Week coming up here. Then we also have National Healthcare Worker Week as well. It gives us a great opportunity to recognize the dedicated people that are in healthcare, and just to give them a chance to show our appreciation for all they do for us and for the community.
Absolutely. So important. So important. The long hours and all that's asked of our nurses and our national healthcare workers, or just healthcare workers in general, so appreciate their time, effort, and energy.
We
and
do.
The fact that they wanted to go into the field.
Right. Yes, it's a difficult field, very challenging, but very rewarding at the same time.
Yes. What else is going on in May? Got a couple other things as well, Pat.
Well, we do. Just to tie in with that, the National Hospital Week, May 11th through the 17th, they've actually got a theme this year, and it's #WeAreHealthcare. And we like to do some fun at the hospital, too. We're going to have some fun events for our employees. We'll do a cookout. We'll have a ice cream sundae bar for them. We'll do some popcorn, and we'll do some drawings for the employees to win some prizes. Just a small token to say thank you for all the work that you do. And it's also, too, we like to show our appreciation for the community and for the region for their support for the hospital, because if they don't come to us, we won't have a hospital here. So we certainly appreciate that. But then also May, too, very important, Mental Health Awareness Month for the entire month of May. Lots been said on that. We know how crucial mental health services is, not only for this region, but really for the entire country. Just a great opportunity to continue to bring awareness for this growing, what we would call a growing problem in our society today.
Okay. And that's first and foremost on the minds of everyone in healthcare, trying to provide more and more mental health therapists, patient advocates, people like that.
Mm-hmm. Yeah, and there's a great need for it. Like Pat said, since I've been in this role, I've just noticed a lot of people also struggling as well and identifying with that. So there is a great need in the community for that service as well.
Okay. Remind us about McDonough District Hospital and the MDH Clinic, Bill, and what you guys do to serve the community.
What do? We try to do everything, right? We provide the best patient care possible. We do a lot of lab draws. Our rehab department up here in Monmouth does a great job. Lori Fox does wonderful work here, knows a lot of the community members, and she continues to elevate that department every day. What else we do? We try to provide convenience for all of our patients as well. We have the lab drive-through draw station at the hospital, and now we've got the community retail pharmacy. Right, it's started in January. It's maturing. We're starting to see that grow now, and it's been a very big satisfier for everybody.
Good. I wondered how the pharmacy was going.
Right.
It's been open, like you said, since January, and it's growing. Now, it's open to anybody in the community, correct?
That is correct. And we just recently started filling meds for animals as well. So that's a big satisfier for a lot of people.
Okay, tell me more about that.
I'll let Pat speak to that piece of it.
Well, and that's not something you would typically think a pharmacy would be able to fill. But yes, if you have pet meds, you got a prescription for it, call our pharmacy and just to check to make sure that they can fill it. But yes, we've been able to fill pet medication. So again, another patient satisfier. We want to bring convenience to the community, and this is just another opportunity for us to do that.
Okay, yeah, you traditionally think of going to a vet.
Right.
Yeah, and it would be obviously the prescription from the vet, but yeah, they can call it in and you could have it filled.
Isn't that something? Well, animals are like, children in some cases.
Right.
So.
Right. So you can pick up your prescriptions
Yeah.
and your pet's
And your
prescription
pets.
all at the same time.
And a coffee while you're at the...
And a
Well,
coffee.
it's true, yeah.
Yes.
Cold
Brew house,
brews
yeah.
there, right?
Yeah,
And,
how's that going with that coffee place? I bet that's good.
It is good. We see employees get over there. We like to keep encouraging people. They're open Monday through Friday as well. In fact, they get an early morning start earlier than what the pharmacy opens up because you get the people coming into work. You got to have that cup of coffee as you're coming in, or anybody in the neighborhood can stop by, use the drive-through actually that early hour, and get your coffee.
Isn't that something? It's amazing. You're building a campus,
right?
Pretty much.
Yep.
I mean,
basically,
yeah.
Yep.
That's what healthcare is becoming. Is a campus, even in our smaller rural areas. Right. Okay, let's talk about retention. That's on your mind. Retention, limiting turnover, recruitment. Bill, tell us about your strategy.
Yeah, as you know, Vanessa, healthcare is very challenging. It's very rewarding at the same time, but people get burnt out. So we try to do the best we can to recognize and reward our staff. We're also out there actively recruiting in the community, where Pat does a great job touching base with colleges and just trying to build those relationships. And we invite all the students into our hospital as well, just to get them comfortable with our culture and how we operate, and try to recruit them that way. And it's been very successful so far.
Good.
And we've actually had our first class wrapping up for the CNA program, new program that we started, where we're offering classes. You can get certified as a CNA and just start your career if you want to pursue nursing as your healthcare dream. This is an opportunity that we are providing to do that. We're going to have another group starting up in the summer. Again, you're just trying to grow your own, especially when we can do that locally. But it's more than just nursing, too. We've been talking with a lot of healthcare students. In fact, I just talked to one student last week who's interested in going to physical therapy school in this fall. Just talking to them now, hey, just remember when you're done, we've got 4 great locations for our sports med and rehab. Obviously, here in Monmouth, we got 2 in Macomb, 1 in Bushnell. When you find good people that are skilled and they want to get into this profession, they got a passion for healthcare, we want to do everything we can to try and recruit them to come to work at our place.
Yeah, and sometime we'll have Dr. Lori Fox come in as well. Everyone knows Dr. Fox, or they've had her as her skill set put to use with injuries and rehabilitation. Some of it's sports, some of it car, accident related, all kinds of different reasons that she's able to help people. Mm-hmm. Keyword is help.
Yep, it is. And she's known locally, so everybody knows her, right? Yeah, she does a wonderful job.
Building relationships, that's in growing our own. That's a really key statement that folks, not just in the healthcare industry, but all around our rural communities, are fighting and trying hard to keep young people.
And I think that is a challenge, too, because some people want to get out of the rural setting. But to us, when we bring people in to recruit, you sell them on the quality of life. And I think there's a lot of people who want to enjoy the smaller town living, working at a smaller hospital where you walk down the hallways, you can see the CEO on a daily basis. You can see the leadership on a daily basis, instead of at a bigger organization that might have 2,000 to 3,000 employees, where you don't even know some of your own coworkers in the next department because you guys are so big. So I think it's the ability to be able to sell people on that, and just in the region too, because we always believe we get them here on our campus and we bring them to the region, we can sell it, because it's all about the people, it's about the relationships that you can make, and it's the quality of healthcare that we provide to our community and to the region.
And Bill, I'm sure you'll be off to conventions, conferences, all of those things for this summer. I know there's a ton of them with different products, with different types of new ideas, AI, robotics. It's all on your schedule.
It's all on our plate right now. Yeah, AI is very big for us right now. That could maybe alleviate some of the staff burden that we're experiencing. Robotics, you touched on that as well. That's another venture we're looking into, and we can use robotics as a recruitment tool. You have these young doctors coming out of residency. They see you've made the investment in robotics, and they think, okay, now you're up on your technology. This is where I want to go. We're on the cutting edge at that point, right?
Yes.
So,
what? Talk about the AI for a second. What kind of? Because sometimes AI scares people a little bit. Everybody's seen the movie Terminator, right?
Right.
But we're talking about a different form of AI when you're helping at a hospital.
We really see the opportunity on the revenue cycle side, where It scrubs a bill before it goes out to the insurance payer. It reduces denials because we don't get those rejections like we used to. So it does a lot of that upfront work that we do not require physical touch on those accounts and everything. So it really improves efficiency. And it's all behind the scenes. You don't see it out front there or anything like that, but it's a very useful tool for us.
Okay. Anything else that you want people to know about McDonough District Hospital or the MDH Clinic here in Monmouth?
Oh, wow. I think, I've been in this role a little over a year and a half now. We've really done a great job elevating the culture. We've reset our mission, vision, values, and we're really taking the organization to a new level. Pat mentioned about retention and working with students, and it's all about the culture and getting them in there, making them passionate about their jobs, and providing that work-life balance that they need to succeed.
Okay. Well, you guys are doing great. I appreciate you keeping people up to date about the hospital and the clinic here in Monmouth and investing in our community.
Thank you. You're welcome. And Vanessa, we want to give a shout-out to all the area sports teams. I know you're wrapping up regular season. You got postseason competition coming up. Want to wish everybody the best of luck as they finish up the 2025 seasons.
Yeah, we got softball, baseball, track, and girls soccer.
Oh, wow.
So a lot going on in the area. And tonight is Macomb and Monmouth Roseville for baseball.
That's always a good rivalry,
Yeah.
especially in baseball.
Yeah, that'll be on Sunny 97.7 coming up this afternoon about 4:30, pregame show about 4:10. So, gentlemen, thank you so much.
Thank you.
Thanks, Vanessa.
Bill Murdock with us. He's president and CEO. Patrick Osterman, vice president of business strategy at McDonough District Hospital and MDH Clinic in